Aphthous stomatitis or Aphthous ulcerations. What are Aphthous stomatitis or ulcerations? Aphthous, Aphthous, Aphthous stomatitis or ulcerations. This is a very common disease and generally found in the OPD. So what is definition of Aphthous stomatitis or ulceration? It is a recurrent, painful, superficial ulceration of tongue and buccal cavity. So recurrent, very important is recurrent. जिसके मुंह में छाले होने लग जाए तो बारी बारी होते रहते हैं थोड़े थोड़े दिन. Recurrent, painful, superficial ulceration of tongue and buccal cavity, which includes lips, tongue, I have already told you, buccal mucosa under the cheeks, soft palate and floor of the mouth, जीभ के नीचे. सो कौन कौन से एरिया? लिप्स हो गए, टंग हो गई, फ्लोर ऑफ द माउथ, मेम्ब्रेन अंडर द चीक एंड सॉफ्ट पैलेट पीछे जो. सो दीज आर इंपॉर्टेंट साइट्स ऑफ एफ्थस अल्सरेशंस. पैथोजेनेसिस, the site becomes red and painful, and on second or third day it ruptures and forms an ulcer in a day or two. So first there is redness and pain at the site of formation of ulcer, then after 2 or 3 days it ruptures and forms an ulcer and which is painful. Now, what are the causes of Aphthous stomatitis? It is typical, present, that is on the tongue, buccal mucosa, soft palate, etc., multiple in number and may recur over a period of several weeks. लगातार होते रहते हैं. It may occur when there is emotional upset and premenstrual period, stress and strains of life, then ulcerative colitis or Crohn's disease, malabsorption syndrome, celiac disease, Behçet's syndrome. So these conditions like ulcerative colitis, Crohn's disease, malabsorption syndrome, celiac disease and Behçet's syndrome, they are sometimes associated with Aphthous stomatitis. So Aphthous ulceration may be a part of disease or because of nutritional deficiency. As I have told you, part of disease means in ulcerative colitis, Crohn's disease, Behçet's syndrome, it may be associated with these diseases, or it may be due to nutritional deficiency or emotional upset, etc. Now, what is the treatment of Aphthous stomatitis? Number one is, if a patient is wearing ill-fitted dentures, that should be avoided and it should be properly fitted. So, number one is this lead to over bruising of the mucosa of the cheeks. Number two, hydrocortisone pellets or cream may be applied on the site of the ulcer 3 times a day. It gets stuck to the ulcer. Number 3, for secondary infection, systemic antibiotics may be used like amoxicillin and metronidazole, etc. Heavy doses of B complex factors, xylocaine jelly for local use, and use of Rebagen. There is a new drug which is Rebagen, 100 mg 3 times a day. So Aphthous stomatitis is very important, and important cause besides the infection is emotional upset, premenstrual period, and day-to-day life strains, and etc. It may be associated with various chronic diseases like ulcerative colitis, Crohn's disease, Behcet syndrome, and malabsorption syndrome. So this was all about Aphthous stomatitis. Now I will be talking a very important part of this lecture, that is systemic disease and oral ulcerations. So there are various important disorders of oral mucosa and tongue which are part of the systemic diseases or may be associated with systemic diseases. So number one is leukemias. So leukemia will lead to gingival hypertrophy, bleeding and necrosis, and petechiae and ulcer formation in oral mucosa. So first important systemic disease of oral ulceration is leukemias. Number second, thrombocytopenia, as may occur in patients of dengue fever or other causes like even like leukopenia in leukemias also, aplastic anemia, bone marrow depression, etc. In these conditions, even portal hypertension with hypersplenism, it leads to decrease in platelets and there is formation of multiple petechial hemorrhages in the oral mucosa and hemorrhages may be there. So second cause is thrombocytopenia. Third cause is Plummer-Vincent syndrome. This is iron deficiency leading to dysphagia. This is called Plummer-Vincent syndrome. Also known as Peterson-Kelly syndrome. Peterson-Kelly syndrome. In this, the patient is having iron deficiency along with atrophy of the papillae of the tongue leads to smooth and balled tongue. The tongue is red and sore and smooth. Papillae are absent and there is associated dysphagia, difficulty in swallowing. Fourth is B complex deficiency, as I already told you, vitamin B2, vitamin B12, nicotinic acid, folic acid deficiency may lead to ulcerations. Then fourth is B12 factors. Fifth is scurvy, that is vitamin C deficiency. Ascorbic acid deficiency will lead to swollen bleeding gums and petechial hemorrhages in the oral mucosa. Swollen bleeding gums. Then sixth is pernicious anemia, iron deficiency anemia, pellagra. These all lead to pernicious anemia, then B12 deficiency anemia, and pellagra, nicotinic acid. These also lead to ulcerations and balled tongue due to loss of papillae. Then the next important systemic disease is candidiasis. I have already told you. Oral thrush, that is white fluffy membrane which is present on the mucosa, in the gingiva, tongue, back of the tongue, pharynx, buccal cavity, cheeks, etc. Then syphilis. Syphilis has three stages: primary, secondary, tertiary, and fourth one is congenital. In primary syphilis, there may be primary chancre of the tongue. syphilis. In primary, chancre on the tongue. This is in persons who indulge in oral sex. Chancre on tongue, even on lips, etc. In secondary syphilis, there will be mucocutaneous lesions with central ulcerations. Mucocutaneous lesions with central ulcerations. Then in tertiary syphilis, there will be gummatous atrophy of tongue, gumma formation. It is called gumma. Gummatous atrophy of the tongue. Gummatous atrophy of the tongue and ulceration of soft palate. Then in congenital syphilis, Hutchinson's teeth, glossitis and angular stomatitis. Congenital syphilis में क्या होगा? Hutchinson teeth, irregular shaped teeth, Hutchinson's teeth. Then oral ulcerations and glossitis of the tongue. These are present in congenital syphilis. Then another very important systemic disease is Stevens-Johnson syndrome. Stevens-Johnson syndrome. It is usually caused by side effect of sulfa drugs. Stevens-Johnson syndrome. Stevens-Johnson syndrome, it is erythema multiforme. रेड करके बहुत सारी जगह पे पैचेस होंगे in the buccal mucosa. Ruptured bulli in oral mucosa, lips and skin with surrounding inflammatory zones. The bulli formation, rupture with surrounding inflammation. So what is Stevens-Johnson syndrome? It is erythema multiforme, ruptured bulli in oral mucosa, lips and skin with surrounding inflammatory zone. Then recurrent Aphthous ulcer is the next finding on systemic disorders. Single or clusters of ulcers which are painful with surrounding erythematous border on lips, tongues and mucous membranes. As I have told you, in various common systemic disorders. Then lead and bismuth poisoning as may occur in persons who are painters. Painters होते हैं, वो पेंट करते करते ब्रश को मुंह में कर लेते हैं, साफ कर लेते हैं उसको. तो पेंट जो है धीरे धीरे करके उसमें लेड होता है पेंट में. That leads to chronic lead poisoning and produces bluish lining at the base of the gingiva. It produces pigmented dark line along gum. So that is lead and bismuth poisoning. Lead poisoning का हमें ऐसे पता लगता है. ये टंग है, ये teeth है, and there is gums, और gums के ऊपर आपको एक डार्क लाइन दिखेगी. This is called lead poisoning, and it is because of chronic lead poisoning, usually occurs in painters. Then Behçet's syndrome. Behçet's syndrome it's a connective tissue disorder. Behçet's syndrome. collagen disorder or connective tissue disorder involving joints. Then there is Aphthous ulceration, genital ulcerations, Aphthous, genital ulcerations, and iridocyclitis. Iridocyclitis means involvement of the iris of the eye. Inflammation of the iris of the eye is known as iridocyclitis. So these are important systemic conditions which have manifestations as oral manifestations in the clinical presentation of these illnesses. So with this, I will conclude the topic of stomatitis. So this topic may come to you as small note or fill in the blanks like Behcet syndrome, similarly lead poisoning, greenish lining, similarly gum hyperplasia, in which conditions, etc. So coming to the conclusion, that we should first of all take care of our orodental hygiene with proper brushing of teeth, mouth washing, etc. And then if there is any illness, that should be treated properly. So concluding, and before coming to the end, I will again request you to go to the Google Play Store, download my app Dr. Ashok Kumar Rana, and then join me with various other lectures. Thank you.